So, for our final session of the day, Kath Malhotra is going to take us through making physical activity everybody's business.
I get the graveyard. And there are still quite a few of you here, so that's a relief. So I think a number of you know me as the Personalised Care Clinical Lead for RM Partners. I think I was the only one on the programme that just didn't seem to come from anywhere. It's just Kath Malhotra at the end. And one of my colleagues said it's just like Madonna. So, or maybe prima donna. So I'm here for the entertainment factor for the last half hour to just keep you going. Because well done, you've made it through a whole day, and as this is all about physical activity, do not panic. You're not about to do a workout. Not quite. I've worked at RM Partners now for 2 years, but before I joined RM Partners, I suppose my disclaimer is I'm a physiotherapist by background. So I'm one of the AHPs in the room, and it's been fantastic to hear lots of sort of different approaches today. But my aim is to make physical activity everybody's business. And prior to joining RMP, I was at RMH, so I was at the Royal Marsden in a number of different roles. So I'm going to take you through. I should have been joined today by a colleague, Sarah Dewhurst, who's already featured on slides, if anybody spotted it in Sandra's slides. She was part of the workout in primary care, so it's great to see. She's just everywhere. And she's not here. So I am presenting on behalf of her and myself, and there will be a little bit of Sarah within the slides. And so I need to acknowledge her thanks for putting this together, but also for one of our physio colleagues who works at the South East London Cancer Alliance, and that's a physio by the name of Isla Veal, so people may be aware of her work as well. So I suppose my first question, and I am going to get you moving, don't worry, is about how confident you are with giving physical activity advice. So this is about, if someone asked you, what should I be doing to keep myself active? How confident would you feel to have that conversation? And obviously there's a scale of 1 to 5. So what I want you to do is everybody stand up. Everyone read it. Tights up. Okay, so it's not being recorded. Okay, right, so what I want you to do, so obviously there's a scale of 1 to 5. Those of you who feel very confident about talking about physical activity with your patients, or maybe even with your friends and family, because you may be physical activity persona, I'd like you to sit down. That's a relief. So there's a few of you, that's good. Okay. What I want to see now, those that maybe would put themselves as the number 1, maybe into number 2, of not feeling confident, or maybe a little bit confident. Oh. I'm preaching to the converted. Does that mean we can go home? Okay, so if you're feeling moderately confident, wave your hands in the air. Oh, that's not a wave. Okay, and now you can sit yourselves back down. Okay, so we've got people sort of at about number 3 was sort of the general consensus. And that's actually pretty normal. I think a lot of people, and if you want to go into the world of research, which I haven't, but your Likert scale, everybody tends to put themselves slap bang in the middle. So there's often a bit of confidence, and maybe that confidence grows. And that's what we really want to try and ensure that we're putting in place. So I'm going to give you a whistle-stop tour because I just want to make sure that we do finish on time. And I can talk for England about physical activity. But putting it in context, why are we talking about it, or why am I talking about it to you today? And it sits under workforce for a reason, or thinking about how we support all of our clinicians to feel confident about talking about physical activity, because we know it's beneficial. It's beneficial from a whole population perspective, but it's also really beneficial for our patients who are dealing with a cancer diagnosis. And the reason that is because we know that the prevalence of cancer is increasing, that people are living longer as a result of treatments for cancer. So people are, who've had a diagnosis, half of those will be living 10 years or more. But we want people, and as a personalised care lead, it's kind of like the mantra of living with and beyond, but we want people to live well with cancer and beyond. And physical activity is not maybe that extra pill, although sometimes it's sold as that in the papers or the research that you see. But it is potentially something that can go alongside the recognised treatments for cancer. And so when someone has a cancer diagnosis, often cancer is viewed as a disease of age, so there's naturally ageing anyway, but we know it accelerates ageing. I feel like this is the doom and gloom bit. There's declines in physical activity, we know from research by Macmillan. Often those people that maybe even were active before they had a cancer diagnosis really struggle to get back to a level or the equivalent level of physical activity afterwards as well. That is changing because the conversations about physical activity, the sexy word of prehabilitation, is very much sort of in people's mindset, but it's not part of standard care. And we really hope that eventually it will be, but the real challenge is around funding that and implementing and really understanding what the best model is. So actually, starting with having a conversation about physical activity alongside other lifestyle adaptations is really important. And, there's a shout out here to what we know as well from the impact of cancer is that the change in people's physiological systems. So there's increased risk of heart disease, potential changes to your cardiovascular system, nervous system changes, impact upon the MSK system, sarcopenia, so the loss of skeletal muscle, and all these lead to an adverse change in health, function, quality of life and survival. So, can't have a conference without a triangle. I think it might be the first time it's appeared. Though actually, maybe Sandra, I think there might have been. It was there. I was looking. So BDI's Malhotra spotted the triangle. But when we're thinking about the care that we give, if we're taking a personalised approach, and that really is about individualising our approach with our patients, we still have to think about it in regards to universal, targeted and specialist. And we can think about physical activity in the same way, where there are some universal offers that benefit a whole population, but for some people there may be a need for more targeted or more specialist, particularly depending upon complexities that they're presenting with. And we know so many of our patients present with other long-term conditions or health concerns. But still having that conversation about physical activity is a great starter. What we also know, and I think, the discussion around Ascend, discussion around even sort of what's included in undergraduate education, there's still a gap in knowledge, time, we recognise, and also skills. So there's been quite a lot of research undertaken about understanding what sort of people's awareness is about talking about physical activity, not even just within cancer, but just generally. And a number of our healthcare professions will acknowledge that they feel underconfident because it's not covered particularly well or even at all in a lot of the medical curriculum. And even the physios, myself included, even when they were surveyed, a number of them could not state all components of the Chief Medical Officer's, I'm running out of steam here, Chief Medical Officer's exercise guidelines. So, we're not all perfect. So, why are we talking about it? Well, there's a number of issues that our patients with cancer highlight as being problematic. And that relates to mobility, issues around pain and discomfort, anxiety and depression. We know that these are patients who are completing the quality of life survey 18 months post-diagnosis. So for a number of them, they're quite a way out of the system. But also, just thinking about our cancer prevalence and the changes in treatment, the complexity of the patients that we see, a number of patients maybe still be on ongoing treatment, because they may be in that tranche of patients that we're seeing now with treatable but incurable cancers as well. So we need to think about how we can support people, again, to live as well as possible. And we know that physical activity can impact upon improving mobility, it can help with self-care, usual activities, and also help to maintain or support someone that has pain issues. And it's not just an impact for physical health, it's an impact for emotional and mental health. Hence it can impact quite significantly to help with anxiety and depression concerns. So I've highlighted here a number of the benefits. If we go down to sort of individual thoughts, improve sleep, reducing fatigue, helps improve heart function, can reduce the risk of diabetes, stroke and heart disease, or help minimise some of those side effects as a result of maybe developing those with your cancer treatments. It also offers a real element of control for our patients. That's what they often say, is they feel like they really love the opportunity to feel like they're doing something for themselves rather than being told what to do. And the peer support and potential self-esteem improvements have also been demonstrated, where there's an opportunity maybe to exercise in groups or, with like an exercise buddy, etc. We use the term teachable moment. There are lots of touch points with our patients, and often cancer diagnosis is a teachable moment. It is that point where maybe there is an opportunity to talk about some of this. Sometimes we're a bit concerned that, oh my God, they're so overwhelmed with everything, they're dealing with the diagnosis. But actually, with a lot of the work that we've done, a lot of our patients are saying they don't want to hear about this right at the end of their treatment. They want to hear about what they can do to be physically active and maybe change some of their other lifestyle choices, like nutrition, much earlier, so that they're doing as much as they can to support themselves at the beginning and through treatment. There's also a recognition in the research of a known risk reduction of disease recurrence in certain cancers. Now, that's definitely been demonstrated in breast, colorectal and prostate cancers, because we're able to gather quite a large volume of research, because they are a larger volume of patient groups to be able to explore and understand. So if there's a risk reduction with that group, then it's kind of extrapolated that potentially we're going to see it with some of our other patient tumour groups as well. And I think that's a really strong message, that if you're physically active after a cancer diagnosis, you can potentially reduce the risk of your disease coming back. It does come with the caveat health warning that you will have all seen that patient who's done everything right. They haven't drunk, they haven't smoked, they haven't eaten red meat, they only drink maybe red wine, they don't, they've exercised, blah, 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 and yet they still have a cancer diagnosis. So, we have to be really mindful of the way that we have those conversations so that people don't feel blamed or challenged. And we know that there can be other health benefits as well. And also it can support people in stratified follow-up because they can participate in their own care and choices to treat side effects. I'm going to give you a quick view of the Chief Medical Officer's recommendations. Prior to joining the Alliance, actually for a little while after, I had a role as a physical activity clinical champion and would often provide education around having those conversations to support and enhance and encourage people to be physically active. So you've got there in front of you sort of an awareness of the number of hours people tend to know about cardiovascular activity, the 150 minutes per week of moderate intense exercise. Minimising sedentary time, we got you to do that by standing up, or I did. Improving your balance, and they often say that this should be sort of like from the age of, I think, from your 40s onwards. I would challenge that and say we should all be trying to challenge our balance the whole time. And then there's a real message now, and that's why it's there in the centre, around building strength. So there's a QR code, because we love QRs. So there's a QR code to the Chartered Society of Physiotherapists website where they've developed a lot of resources around strengthening exercises, and there are resources there for professionals to be able to have the conversation, but also resources that you can signpost patients to as well. The reason I've put this up here, it's an opportunity, isn't it, to just get you thinking about your own physical health and well-being and challenge yourself around what you can do and what you can maybe change in your own practice. Okay, what we do know is that some is good, more is better. And if we have that conversation about 150 minutes, it can feel a bit like, oh my goodness, I'm not sure the patient in front of me could manage that. But actually, if they could manage something, it's better than not doing anything at all. Now, the reason why there's also, so that's kind of like, that's a no-brainer to me of why we should be having those conversations. But there's also, in my little hat of being a personalised care clinical lead and knowing I support a number of my colleagues out across the Alliance with ensuring that data is collected, but actually it's not about the data, it's about the quality of those conversations that people have in practice with HNAs and personalised care support plans, and also the end of treatment summaries. And that data can be lifted from the trust system, she says optimistically, can be, should be. If you're in Somerset, it is. If you're in for Flex and Epic, we can't see your data yet, but who knows. But it's then shared and it can be seen on the Cancer Stats 2 through COSD, which is Cancer Outcomes Service data set. But within that, there is also a metric of physical activity assessment. Now, that's been collected for years, but is not shared, and but will be over the next year. And so it's been written into our NHS planning that they are really keen to ensure that there's regular conversations about physical activity, or definitely that when people are in the hospital, they're being asked about their physical activity levels, and that is actually documented within the notes and the records. But as well as asking the question, it's about then having a bit of a backup and knowledge to be able to continue the conversation and encourage people to be more physically active if they feel that they're not, or you feel they're not meeting the levels, and they could, with some support, do more. Okay, I feel like I'm wittering. What I thought was quite useful, so we know that that's an ask from NHS England. That's kind of one of the responsibilities that sits with me as a personalised care lead, and to try and support our clinical colleagues out in practice to make this happen. Now, one of the challenges, that data is there. Currently, it's being used by Public Health England, or OHID as they are now, and that data has been historically used as a risk factor. So a bit like smoking behaviours and alcohol behaviours, they've used physical activity against different tumour groups to try and understand the nature of the disease and why people may develop certain cancers. Now there's a recognition that maybe we can look at physical activity alongside personalised care delivery. So that's really the ask for us, is to ensure that that data is captured, but it's not just about the data, it's about ensuring that our colleagues feel comfortable and confident to have those conversations. So I'm going to share a couple of approaches that have already been undertaken ahead of all this work, because again, we knew that physical activity was of value. So the trust approach is from RMH. Hands up who does work at the Marsden. There's a few of you. You might have heard this one before. So this physical activity strategy was launched in January, I think, middle week. Quite a tricky time of year to launch a physical activity strategy, because maybe your weather's against you. But the reason it was launched in January is like, we just want to crack on and make it happen. But it was launched then because often New Year, resolutions, people might get a gym membership for a few weeks and then stop. But, you know, why not? So the physical activity strategy has been revamped and launched within the Trust, and this is what Sarah would have joined us to talk about. But it was born out of the work from 5 years ago from a Darcy Fellowship, and the Darcy Fellow was myself, so I'm a little bit biased about this strategy. But it's great to see something that started as a small project and watch it grow and see how it's developed. And it was a co-designed approach with a number of stakeholders, including a number of patients, people utilising services. And we learnt a lot from the patients at the time that we developed the initial strategy. And in fact, the strategy hasn't really changed. The components have remained the same. It's very much around trying to support the role of physical activity promotion to be part of routine care. So it's part and parcel and everyday business within the trust. And the strategy, with the support and guidance from the patients, ended up sort of having, I suppose, four main aspects, which are around resources and partnerships, education provision for staff to feel more confident to talk about physical activity, active environments, and also digital technologies. And when we created the strategy, it was had a soft launch in kind of 2019, December, and then something happened that kind of restricted anybody being active, except for half an hour a day. And if you were in hospital, you weren't allowed to walk between different wards, and it was all a bit of a, oh dear, what's going to happen? So the team kept it going as much as possible, but actually, in a way, COVID was a bit of a caveat and really helped to get the digital technologies underway, made people think about things in a different way, and allowed for building of relationships and partnerships with some of the community providers as well. So it wasn't all doom and gloom. And now that strategy has been revamped further. So it's about making it everyone's business, that the trust is known as an active trust, where no one can be a patient without being asked and supported in physical activity goals, and that there's some collaboration, and also the service see that it's also laying the groundwork for taking physical activity to the next level for that therapeutic exercise for prehabilitation, exercise oncology services, improved facilities and opportunities to contribute to research. So it's quite an exciting document, and it isn't a document, because I always remember when I said, oh God, I've got to write a strategy. It's just going to sit on the Marsden intranet, and people might search for it occasionally. But it's a living document and far more active.
I'm really proud that we are one of the first trusts in the country to have a physical activity strategy. And it's really in recognition of the strength of the evidence linking physical activity to good health generally, but also within cancer care. So we underwent a co-design process where we worked with patients and staff and external stakeholders to find out what was important to them and what was going to make the difference to really achieve the culture change that we need to embed physical activity as part of our standard of care.
I think a physical activity strategy is really important for the hospital. There's loads of evidence now that physical activity is both good for the patient's mental well-being and their physical well-being, and also the outcomes for their treatments are improved if patients are fit and active.
We know how important physical activity is for cancer patients, and I think it is important for the Royal Marsden to have a strategy. They've had the vision, I think a strategy and a framework which can drive through the steps and make the lives of patients much easier.
Part of the remit of our work is to really support and enhance the experience for our patients and carers and people living with cancer in the West London area. So having the strategy as an example helps us to think about the physical activity offers that are out there for people to access. And that's certainly something that's part of our planning work going forwards, is to really understand what physical activity is available for people, what the needs are, and the confidence of staff being able to talk about those benefits.
So when I went through my cancer treatment, I exercised all the way throughout, so through my chemo, my radio, surgeries. So I'm really hoping that this strategy is going to be really helpful for many other women going through this diagnosis. You can stay strong, both mentally and physically throughout all of your treatment.
I think physical activity will make a huge difference to our patients. In some of the diseases that I treat, like prostate cancer, where we give men hormonal therapy, we have good evidence that physical activity counteracts some of the adverse effects of the treatment on the patients. It's also fun. People have a great time doing physical activity, and therefore is really good for both physical health and mental health.
I've been diagnosed with prostate cancer, and to be totally honest with you, if it hadn't been for physical exercise, I don't know how I would have really got through my journey. Started before any kind of treatment. Exercise is very important. It helps you in a mental state of mind and lifts your spirit.
If I hadn't been keeping active through treatment, would have been really poor. So I was really, really helped by the team. I'm a self-employed single mum of 2 daughters, and if I don't work, I don't get paid. So it was really important to me. It kept me happy, it kept me joyful, which was really important.
We celebrate laying the foundation for physical activity to be a standard of care for people living with cancer with our first physical activity strategy.
So I think they've put together a really lovely video because it's highlighted so many different things that you can do, and it's been really exciting to see that develop. You know, having the dogs on the ward, woohoo! You know, the guided walks, utilising the volunteers, and it created a real momentum. So it was really exciting, and for me, I just feel so proud to have seen that happen, because you don't often get to see what happens next. So that's just been fantastic. And they've got a specific focus. It's really hard. There's not one person that's sort of designated to take that role on. It's just sitting with Sarah just because it happens to, but it's not her sole job. So sometimes it's very much around building that network, building that community, to really make a difference. So there's a number of things that are happening. And one of the other things that they developed, they've got the guided walks with the volunteers, but that was off the back of, there was some innovation, I'm not sure we're allowed to call it Innovation Den money, but it was some charity money that was awarded pre-COVID, and then it was really difficult to develop walking routes because we couldn't have anybody on site. But then with a group called Living Streets, they've developed some walking route maps that patients can download and visitors to the sites at Sutton and Chelsea. So it's just sort of different ideas to try and sort of float your boat and think about what you might be able to do back in your workplaces to make a difference. Yes. 2 minutes. Okay, so I'm going to whiz through. There's a couple of resource slides here. So Isla Veal is a physiotherapist who works at Guy's and St Thomas's, and then she went into a project role at SELCA, which is South East London Cancer Alliance, and they'd really established a very good sort of physical activity and exercise network out of Guy's and St Thomas's through their sort of service delivery, but they wanted to create that more widely across the whole system of South East London, and they cover 6 boroughs with 3 trusts. For the majority of us, I think the majority of people in the room work within the RM Partners footprint, North West and South West London. That's 14 boroughs, not that it's a competition, but that's 14 boroughs. That's a massive population and a massive geographical area. I know we have got people from UCLH as well. So, and kind of we're all sort of bordering each other. But there's a real challenge, isn't there, to sort of work across the whole system and get those messages developed and delivered. So Isla did a lot of work for the year, and what she's done is all her hard work is now housed on the SELCA website. So these are resources that are available for any of us to access. They're free. There's a number of staff support, staff resources. You can use the QR code, and I think the slides will be available, won't they? And some top tips related to different diagnostic groups as well. So if you're working in a particular area, so you're working maybe with gynae patients, you might want to look at that information because, again, it might guide you in some of the conversations that you have. But there's also a number of resources that they've made available for patients. There's some webinars on their website as well that have been delivered for patients and staff all together, talking about physical activity and how people can help themselves. And that's something that we were very aware of when we did developed the strategy. I kind of feel I've got my feet in 2 camps. But developing the strategy at the Marsden, we did a lot of work with patients, trying to understand what their needs and wants were. And they very much said they just wanted to be part of the conversation. You know, they want to hear what we're doing, we want to hear what they're doing, and it's, you know, it's sort of part and parcel of learning alongside one another. I also thought it was quite useful just to share some of the wider resources as well. So there's a cancer care map that you can use with your patients or encourage them to use. But all you need to do is put the postcode in, tap in the words physical activity, and it should highlight a number of the current resources that are available out there. But the cancer care map only works effectively if those services register what they're doing within those with the team. They're housed at the Dimbleby Centre. But on the cancer care map, there's like a little box that you can click on and put your information in, and then it takes about 10 days to get that information about that service up. If it's restricted to only certain patient groups, you can put that information on, and then at least it's shared and people can access it and know what's available out there. We've also got 5K Your Way. So 5K Your Way is part of the Move Against Cancer charity. It's a free exercise initiative and it runs alongside Parkrun. And the whole point is it's creating a community of support, but also getting people physically active as well. And it runs on the last Saturday of every calendar month. Every now and then they might run it on a different Saturday. So, for example, if kind of around Christmas or New Year, it's an opportunity to bring people together. But you'll have ambassadors running that, and I think Naaman, he's got his finger in every pie, is the London ambassador as well. So we know of two 5K Your Ways within our area, but they're both in southwest London. There's nothing in northwest London. So if you're an avid park runner and you know that you've got a park run that could sort of fit the bill, why not challenge yourself to look into this and set it up yourself? And there's also a link here to the Moving Medicine website, which has been developed by healthcare professionals and sports and exercise professionals. And they've highlighted a number of different diagnostic groups, including cancer. And within that information, they have guidance on how to have a 1 minute, 5 minute, or more minute conversation. So, if you bear with me, 2 minutes going over. Sorry. But this is the really important bit. I kind of chuckled when, her name's gone out of my head, June was talking about planning for planning for planning. We're planning for planning. But I'm just putting my hat out there and saying, this is my plan. But it's still yet to be fully approved. But part of the plan, part of NHS England's every year we get some guidance on what the expectation is that we should be delivering as an alliance. And they are very keen that physical activity is featured within our work plans. And that is really very much around supporting physical activity across the whole cancer pathway and ensuring that people living with and beyond cancer are aware of the benefits of physical activity and have an opportunity for brief education interventions, brief behaviour change interventions, to encourage them to be active but also be aware of the opportunities and support available so that they incorporate activity into their lifestyle. So our intention is to really look at the training, support and information that's required to support staff to have those culturally meaningful brief behaviour change interventions, not just physical activity but also thinking about health promotion as a whole. And also looking to ensure that we cite a lot of the support and information within our web pages and also within Cancer Wellbeing London. And so the next steps for us, we need to be mapping what those physical activity offers are out there so that we can really have up-to-date information. We also, as an alliance, are going to do some work to understand what the data capture process is within the organisations, about if you're having this conversation or understanding what people's physical activity levels are, how that's being documented and how we can see that data in real time. And then the other bit is to introduce a survey, because you love a survey. I, as part of my Darcy Fellowship, undertook a survey with the staff at the Royal Marsden, and I got over 300 responses. And it was really interesting to see what people's own knowledge, attitudes and behaviour was towards physical activity, and then how they used that in supporting their patients. And I just felt it was a great opportunity to utilise the same survey over a whole system to just see if there are similar trends or if there are some gaps, and also evidence of great practice as well. So why not end a conference on another QR code? So my little challenge to you, so I've got two challenges. One, my challenge is, please take a picture of this QR code, download it and have a go at completing the survey. I will confess it's been written with kind of secondary care in mind, because reason being it's just that I've listed the 9 trusts that fall within RM Partners. But there is also a box that you can place if you work somewhere else. You can state where you work. And it's a great opportunity, I think, to understand what's happening for people and, you know, what people have already put in place. And I'd be really grateful if you could kind of share and promote it with your colleagues as well. There will be some further comms coming out, but I thought today was a great opportunity to just kind of grab you in the room. And then my other challenge is just to get you thinking beyond the survey. From what you've heard today, from what you've heard even within this session, are there things that you can take away and put into practice or think about with your teams, with your patients, or with your own physical health and well-being as well? So thank you.
Very quick. I just want to say some thank yous. So I would like to thank all our speakers. I've certainly learned a huge amount today. So we've had some really inspiring speakers. So thank you to all of them. We would like to thank RM Partners for hosting us and for funding the day. It's so lovely to be able to be back in a room with lots of people and not in a little square on Teams. And yeah, we've definitely heard the buzz throughout the room, so hopefully we can build on that moving forward. Thank you to Elaine, it was your idea, so thank you, and putting some speakers together. And a huge thank you to Kath and to Nate for coordinating and making it happen, so thank you. And also thank you to Margaret and the wider conference team, the AV guys at the back who've made us sure we can be heard. And our slides have moved, so fantastic, thank you. So final things, if you can complete your survey, another QR code, do like them. So if you can complete the survey, that would be great. Please share the ideas, please share what you'd like to see in the future. The plan is very much to have a series of webinars, another day like today, setting up communities of practice. So please, complete it and share what you think can help shape things moving forward. The outputs and the presentations from today will be shared at an RMP dedicated page with everything on it. So do look out for that, and that will be shared with you all. So just finally, thank you for everyone's input today. There's been a real buzz and energy in the room, which has been fantastic. So thank you for everyone engaging. Have a fabulous weekend and a safe journey home.